السلام عليكم ورحمة الله وبركاته. معكم أشرف محمد ساجن محمد. قبل ما أجي الأمانة كنت أنا حالتي كانت تعبانة بالمرة صراحة، يعني كنت ما أقدر أتنفس بالجهاز التنفس، ومشي كنت ما أقدر أمشي، ما أقدر أقوم، يعني أحس بالدوخة. وحتى الأكل والشرب، أكل كانوا أعطوني عن طريق التيوب من هذا يعطوني بطن دايركت يروح وين في المعدة. كان حالتي تعبان صراحة، من يقولوني هني يابوني. أمانة الحمد لله بالأمانة إنهم ما قصروا معي، والله العظيم أقسم بالله إنه يعني رعاية بشكل غير طبيعي. والحمد لله تحسنت بصورة، يعني حتى الناس استغربوا وقالوا هالمريض المفروض يكمل له كم شهر، 9 شهور 8 شهور كذي. في خلال يمكن أقل عن شهرين تحسنت أنا بروحي. كان صوت، ما عندي صوت، كان ما كنت أقدر أتكلم. الحمد لله الحين يعني ما قصروا، وعندهم رعاية، وكل شيء يولي يفحصون علي، كل شيء يولي يهتمون فيني ويهتمون كل شيء. يعني صراحة يعني صراحة يعني خدماتهم صراحة، يعني صراحة ما شفت عمري هالرعاية إلا في أمانة صراحة. أمانة يعني أقول هالشيء وأنا أقسم بالله العظيم إن يعني صراحة ما قصروا معي. نعم، فالحمد لله يعني حالتي الحين زينة وتحسنت الحمد لله. اليوم بطلع أنا بروح البيت، قالوا لي فرحان وعيالي فرحانين. كمل 3 شهور يعني تقريبا ما شفتهم هذا، فالحمد لله يعني.
Yeah, when patient arrived at Amana Healthcare, he was having very low GCS, which is like very low brain status to function, low cognition, we call it low GCS. And he was on ventilator, mechanical ventilation for the breathing. He was not able to breathe himself. And he was not able to eat by himself, so he was having the tube through the nose. We call it NGT tube. His conscious levels were very low and he was very agitated. So we were giving him some medication to make him sedate in order to keep his vitals balanced, breathing improved. If he's more sedated, more agitated, then he was having a breathing difficulty, his heart rate was going up. So this was his initial phase. So in that situation, when someone is having the NGT tube for the feeding, we make sure that we change the tube from nose to the stomach. We call it PEG tube for further feeding, and which will be more secure way to feed the patient in this situation, because if you keep this tube intake, then they can have aspiration and pneumonias because they can ingest the food into the lung side. So this is how we managed his initial phase, which was the acute phase. He was very sick. His underlying cause was involving his brain, and he was not able to have a good cognition, good breathing. He was unable to eat, unable to breathe properly. So there was so much support from the mechanical ventilation and the feeding support through the PEG tube later on. Yes, as I told you, he was very sick when he came and he was unable to breathe, and he was on mechanical ventilator on the machine. So there was full team was working along with the physician, nurses, and a respiratory therapist, and a speech and language therapist, dietitian, and physiotherapist. They were all working together in order to fix all problems. Medical team was taking care of his general condition, his agitation that requires many medication to make him sedate and comfortable. We were looking after his diet and the nutrition status. So dietitian was helping out, and respiratory therapist was helping out to make sure that his breathing is fine and how to slowly reduce the requirement. If he is getting better, he requires less oxygen. Then at one point we were able to wean him off from the ventilator. We have some protocols to follow, and step by step the speech and language therapist, and respiratory therapist, physiotherapist, medical team all together, we were able to wean him off from the ventilator, and he was having oxygen through the tracheal tube initially. Then he was tolerating very well oxygenation on room air, so we removed this oxygen as well. And then at one step we had to see if we can take this tube out and he can tolerate that. So a speech and language therapist was helping us to see his capability to have some cough reflex, how he makes sound, if there is any possibility he can swallow feed. So they were assessing according to their policy and protocols, and gradually we were able to wean off the ventilator. Then we took out the tube. He was starting eating orally, and we were able to stop peg feeding, and then we were able to remove his peg. So Alhamdulillah, now he is independent. He's walking, he's eating, he's talking, he's mashallah in full condition. He's very happy to go home. Yes, so as I told you, patient was very sick when he came here, and it was amazing result to see him walking, talking, eating. I was very happy. He was very motivated to participate in physiotherapy since he was more oriented and alert. And now he's weaned off from all aspects. Mechanical ventilator is off, tracheostomy tube is out, peg tube is out, and he's walking independently without support. So he feels so confident and happy to go home. Amana Healthcare team is very unique. In order to have a more improvement of the patient, they work together. Physician and dietitian, speech language therapist, respiratory therapist, physiotherapist, nursing team. They are in such a good coordination. When they take any step, everyone knows what we are going to do. So everyone is on the same page when they are treating one patient. So in that situation, we know what is happening actually and how can we improve the better management for the patient care. So in this case, like when we see the results, we are amazed, we are really happy that everyone is satisfied from their own efforts, and everyone was aware what is the other person is doing for this patient. So this is something like amazing.
Ashraf was admitted in Amana Healthcare last May 29, 2023 with initial diagnosis of sepsis and chronic respiratory failure. Upon his arrival, we experienced difficulty putting him in ventilation but was able to manage on proper sedation. After 2 months of treatment and therapy, he immensely improved. Therefore, we started to initiate mechanical ventilation weaning. He was vitally stable during the course of weaning, and eventually, we were able to pull him out from mechanical ventilation. He was put on oxygen therapy. ABG result is normal with over-oxygenation. Likewise, oxygen flow was titrated from 1 liter per minute, which eventually weaned off. Speech-language therapy assessment was done, and cough deflation protocol was initiated. He was cooperative and enthusiastic about the therapy management, and eventually, we were able to successfully perform the cannulation with no noted complications. He was also vitally stable during the procedure. Incentive spirometry started to improve his lung function, and as per protocol, ABG result is normal. At present, activities of daily living has improved, and he is finally recommended for discharge.